Christy, are you there?
This call may be monitored or recorded for record-keeping, training, and quality assurance purposes. ChiroHealthUSA, this is Elizabeth.
Hey, Elizabeth, it is Brad Cost. Is Christy there?
She is not in the office today. I can get her a message.
Would you? I'm getting ready to do her webinar, and I've just got a couple of questions. Could you have her call me on my cell?
Yes, absolutely. What is the cell phone number?
918-607-9988.
Okay, and that was Brad Cost.
Yes, ma'am.
All right, I'll get it to her.
Thank you.
So I may have one for every week. That
Christy.
I gotta go.
paper. All right, bye.
Hey,
Hey, Christy.
I was just about to call you on your sale. I was wrapping up my phone call.
I thought I was maybe doing something wrong. I've never done webinar jam before, but it's a pretty cool system, I got to be honest.
It is not only super cool, but it is super inexpensive.
Really?
Mm-hmm.
So whenever the people that are watching session, do they see just the screen of the person talking? Does it switch back and forth, or do you see both of us simultaneously?
So simultaneously. So since I have your slides in here, I'll show you what it looks like.
Okay.
I mean, and it'll look the same even when you're sharing your screen. But you see how we pop down to the bottom?
Oh, yeah.
And so let's just say that actually doesn't look too bad, because usually I'll fly through them real quick and see. Oh, yeah, that's actually perfect. Sometimes the bottom doesn't work because people have stuff so close to the bottom. So you can actually move people around the screen so it works better.
Okay.
I can also make our images bigger or smaller.
Okay. And because Jay and I do a lot of back and forth, and when we've done it without this, and that's why I think it's pretty cool, because it displays us both simultaneously as we're talking. We do a lot of, I don't know, banner back and forth kind of thing, and I think this will be a great format to do that.
It will. So we've actually done this with 4 and 5 people at a time as presenters.
Yeah.
With all of them up here, we kind of look like a little bit like the Brady Bunch, or we'll all pop down if there's slides being used. But it's so awesome to watch everybody interact with each other.
Okay, so then the other question is, I want to share my browser, or I need to share that analytics website that we have.
Okay.
How do I do that? Do I do a screen share?
You do. So at the top of your screen, if yours looks like mine, where you turned on your webcam, and then there's the microphone, there's a thing that looks like a desktop computer.
Yeah.
If you click that, it will allow you to screen share. We may get tunnel vision here for just a second, but.
So let's see, I get 3 options. Your entire screen, application window, and then Chrome tab. That's not the one I want, so that's not it. Glad I'm doing this. So it lets me, that's message. It's not showing the screen that I want to show because it's a browser screen.
Well, just open whatever. Hold on, let me see something when I look at it.
Can you see that?
If you will pick the one that has your browser. So like do you have dual monitors set up?
Yeah, I don't.
Oh, well, so you should just be able to do screen share and pick the one that has our faces in it. Then minimize the screen and pull up whatever you're trying to show. So while you're screen sharing, you won't see us on camera.
Okay. Would you still see me though while I'm screen? No, probably not then.
I'll still see you. Everybody else will see you, but you won't be able to see like Jay on the screen while you're screen sharing. Because you'll be looking at your screen.
Okay, so let me switch over and see if you see that. Okay, do you see that now? No?
I don't see anything yet.
All right, maybe I don't have it quite done right.
I still just see us. So make sure you hit the screen share button again. Okay,
Whoa.
now this is perfect. This is exactly what you want. As goofy as it looks. There you go.
Okay, I see. And there's a stop sharing at the bottom.
Mm-hmm.
Okay, so I want to show you this real quick. This is pretty cool. Have you seen this before?
I saw it on the one that you did for Jay's group.
Okay, so if you look at it now, this is the July 26th to August 1st. That's the last data. You can see on a national average, offices are still down 43%. So if you animate it, you go back to January 26th. Now watch it each week, where the greens are where they're a little bit of a gain. And there's always a few offices that are down on patients week to week, but you can now see March 15th and now March 22nd. Look, there are just almost no offices seeing patients, or their patient counts are way, way down.
Wow.
And then it slowly starts coming back. You see more and more green. Now more green. That's May. Little variation.
Well, there's a couple of hot spots too.
Yeah, so the green is good. And now you're starting to see in July, it's changing.
That
And
is
now,
really cool.
and now this last week, we've gone from a low of about 21% loss to we're back again at a 43% loss. So what that tells us is mostly all across the United States, patients have stopped coming in again.
But you know what? This is, at least statistically for our offices, this is the time of the year that we always slow down because it's the right before school starts.
Could be. I mean, that's what we're trying to show docs is this isn't a normal picture by any means, because this is all of my clients, not just chiropractic. So, so it's happening across the entire medical world, you know, and
Which I love that as well, because we are part of healthcare.
Right, exactly. And that's the way I put it. You know, Jay wanted me just to do chiros.
Of course they do, because he's a chiro.
I can, but I think that's the wrong message. So, you know, I'm trying to show it's across the screen all the way from chiro. And guys, we're in this together is the kind of mentality, you know. This tool at least helps you see predictively sort of what has happened in the past, that we are cycling through patients coming in. And that's why I didn't do it on claim count. I really did it on patient counts, unique. We're actually looking at unique patients even in that. So we can tell when a unique patient count is going down. I think it's pretty cool. It's a ton of data to display, but I think it's a pretty cool deal. We're now adding financials to it too, so you can see the financial impact. Now that I can break down by specialty, but I think if you look all across the United States, it'll be hundreds of billions of dollars of financial impact on healthcare.
Oh, no doubt about it.
Yeah. So how's your world?
I am tired of being at home all the time.
Are you? Yeah.
I got to go out of town last week, and it was so nice for the brief time I got to leave town.
Yeah. Did you go to the conference Jay was at?
I did, and it looks like, well, as long as FCA still has their events, those will be the only ones I'll be going to the rest of the year, I think, in Virginia.
Yeah, I've been talking to Jen a little bit. You know, they think, it'll happen, and then all of a sudden they're surveying people, you know, and I think the hotel has a lot to do with it too. This last one, they got postponed. Which one was that? That was the one in Boca. Yeah, I think FCA was all for doing it, but the hotel came back at the last minute and said they just couldn't. And
well, everybody's going virtual, which the first half of the year that was horrible. But we have a virtual events platform because, you know, I work for chiropractor. So we've had it for ever, actually. We just didn't do anything with it. Like we were going to, and then we just, you know, we talked about doing other stuff. Here, I'll show you what it looks like. So all of the states are utilizing our virtual events platform.
yeah.
So this is the one that we did for Chiro Congress.
Yeah.
And then you like enter into the lobby. I don't know if y'all did any virtual events. Like it was rough.
Was it?
Oh, it's terrible. So we have all these different halls where you can be having sessions. There's a booth for the association, but you can have, so the virtual events that took place the first half of the year, there was just no vendor interaction.
Wow.
And so there wasn't an incentive. So this is gamified and you get points. So this is the Choose booth, virtual booth. And there's stuff to download, videos to watch, and you can do a video chat. If you click on that when the booth is manned, it actually opens up into a Zoom room where you can have a face-to-face conversation with an actual booth rep.
I think that's pretty cool.
And that gives you the most points when you're trying to get points to win prizes at the event.
That's pretty cool. I've got to do a large medical conference in Texas. It's an MD conference. And typically, there's a couple of thousand providers there, and I sort of expect it to be something like that. I've not ever done that before, but I knew there was software. I've heard where there have been like 20,000 participants, and it does get you have to have moderators then that are sort of directing traffic. But that seems crazy to me, to be honest.
Well, we have the state association booth that has a video chat. So they'll be on video chat if people need help. There will be a large help desk button at the bottom if they're experiencing technical difficulty. And then we have, depending on the size of the event, how many people we have monitoring that, the chat logs, and then all of the live sessions for those events will take place in Webinar Jam. So I'll be monitoring those while they're going on.
I think that's pretty cool. So has Doc seen a decrease in patients?
Actually, we've been busier than we've ever been. Even though statistically we see less patients this time of the year because it's right as school is starting and everybody's schedule's just off. Last week, both of our clinics were so packed you couldn't even get an appointment.
What about during that mid to end March period? Did it decline for you?
A little bit. When people were under the stay-at-home orders here, our numbers did kind of decline a little bit. Like we went to a modified schedule where we were only open like 3 days a week, but that lasted like 2 weeks.
Yeah. We saw in that 1 week where you saw that chart turn all blue. We saw down almost 90% patient counts across the United States. That's just amazing to me. But in the South, you guys had some mandatory stay-at-homes, didn't you? We didn't ever have mandatory stay-at-home here, but we did have some mandatory shutdowns on restaurants and things.
We had that, restaurants, bars. We did have mandatory stay-at-home orders. Like my husband had to have like some kind of form in his car that proved he was an essential employee just so he could get to and from work. I had one, even though starting right after we got back from the SCA event in March, when I left that Thursday, I never came back to work. And I never came back to work. We didn't go back to the office until July, and we're still only there 2 days a week and working at home 3 days a week.
Yeah, I came back to the office, and I was really bullheaded about going remote. We had never done that company-wide. And I was really, for me, it was more of, this can't be that bad, and business still needs to be business. We got to earn a living kind of a thing. And I fought it until I had 3 of my employees that were moms come in just in this overwhelming tear session about their kids. And, it was sort of a panic. And it made me really think about it. There are people other than myself. This isn't all about business, and I need to protect these moms and employees and family members. So within a week, we had the protocols built. We have to do that because of HIPAA and our accreditation. We just never really done testing other than a few of us be at home and tested. So we were worried a little bit about bandwidth of getting everybody. We were worried a little bit about security, but we went through, tested everybody's home computers for viruses, put a pinhole in the firewall to let them in. And I got to tell you, Christy, it's worked so well. I'm toying with not having a brick and mortar office anymore.
I wonder kind of if that isn't the case, is something that Ray is thinking of, because we actually had record-breaking numbers in the time that we worked at home and had overwhelming feedback and thank you notes. And you've met Heather from ChiroHealthUSA. She gets more fan mail than anybody I've ever met in my life. Like every day, a package comes from a clinic for her, or a letter, or something gets delivered. I promise you, she has like the largest fan base ever. And but that whole time we were gone, we got so many emails about how amazing we were and everything was great. We had record breaking numbers. And Doc's like, look, I don't pay y'all to come into the office. I pay y'all to do a job. I don't really care where y'all do it. It worked out so well. And then for myself and one other employee, we were told to stay at home and not come back.
Well, you know, I do have a very small skeleton crew at the office, about 6 people. They're mainly my network that keep we have our own data center. So we, you know, you have to have somebody there on that. And we kept that small, and there, you know, nobody from the public comes into the office. I mean, the building where my offices are, I own the entire building. It's 100,000 square foot building. It's 15 stories tall. And we typically have 4,000 employees coming into that building. Since COVID hit, we've had less than 100 coming in a day now. So it's like a ghost town. The sad thing is all of the concessions, the deli and the little restaurant have closed down in the building. But this group of people have really bonded tightly, and they feel secure because everybody's health-wise is really good. They've all made the commitment not to go out in the evenings and bring anything into the environment.
Well, I think that's great. Well, and like I said, most of our employees do come in like on Tuesday and Wednesday, but the rest of the week they work from home. We have one employee who absolutely loves being in the office. And he was like, fine, go to the office if you feel better working at the office. But if you prefer to work at home, then work at home on those days. But he was like, you have too much going on. Don't you dare come in the office. When people leave you alone, you're great.
Yeah, my accounting manager has done that. I am going in one day a week to open mail and sign checks and stuff. We've gotten it down to where I can do that one day a week. And I'm really trying to find a service to be able to remotely sign checks. I'm pretty paranoid about moving $1 million a month, through the bank account without my signatures being on it. But anyway,
turn your audio on. I can't hear you, Jay. Did you click on the microphone at the top of the screen? Ironically enough, I think that Amanda meets with Ray like once a month. He signs a whole bunch of checks and then he takes off.
Yeah, we just can't. We have way too much money flow. We cannot do that once a month. We use a real sophisticated software, accounting software, General Dynamics, Microsoft GP software, and they actually have a module we found to do a version of what I want to do.
Well, that'll be really cool. I was going to say, I don't think we send out that many checks. We try to pay everything with a credit card, and she just pays the credit card bill, and we do a lot of stuff by auto draft.
Yeah, I'm not as wealthy as Ray. I don't have credit cards limits that high. I move about $1 million a month in cash. I have been hacked. Last week, the IRS notified me my IRS account was hacked. Somebody sent in a 1040 for me on my account. 2019, I hadn't filed my 2019 taxes. Somebody sent a return in under my name, and they flagged it as fake because I never send a personal. My personal ones are always my name and my wife's as a joint account. And so they flagged it and locked the account down and contacted me. And sure enough, my CPA said, yeah, somebody is using your name. They pilfered your name and social somewhere.
In 10 years, my corporate card has been hacked once, but I can hear you now, Jay.
You can?
Yeah.
Does it sound okay?
Yeah, it sounds fine. My credit card bill alone is the highest in the whole company. However, I also have the largest budget in the whole company. So,
well, I'm okay with using credit cards, but I get hacked every 3 or 4 months. It slowed way down. We determined most of the hacking comes from hotels and restaurants.
So, funny story. I
That's
agree
all.
with you. That used to happen to me when I traveled and I would use my personal, like I used to use my debit card for everything. I don't use that bad boy for nothing. I use an American Express card for everything when I like personal stuff. That way, if it gets hacked, nobody's getting into my bank account.
Yeah, yeah.
After I had to
Well,
change my bank accounts 3 times in like 3 months, I was done.
yeah, I'm the same way with my personal stuff. But the credit cards have never disputed it for me. They just say, give us the list, they credit that back. Have never argued with me. We did have one company that was spoofing AT&T mobile phones, and it was so realistic that I never thought it was invalid. And the credit card company, they got AT&T on the phone. We were on the phone with AT&T Mobile for 2.5 hours. And finally, it was determined that it was an old account, that AT&T merchant account that AT&T had shut down, and somebody had picked it up and was charging all the old AT&T mobile accounts and was charging them almost exactly what their bills had been, and so it looked very realistic. And the credit card company went back 2 years and credited all of that back to us.
Wow.
Hey, Brad, you should check out bill.com. That's what I use. I don't sign checks
Anymore? Is it electronic transfer of money?
Yeah, I don't know exactly how it works, but I have to authorize every payment that's made.
Yeah, that's what we found a module that adds on to our accounting software that's pretty much like that. It's an authorization, and then when it is a paper check, it prints the entire check with my signature on it.
So
Are you notified every time a bill gets paid?
Yep. Yeah. Yeah, I don't. The bank is sophisticated enough to do it, but I tell you what, I've had an embezzle. I had an employee embezzle once, and it was a 12-year-long employee. She was my accounting manager, and I trusted her both personal stuff and business. Just my world's too complex. I can't do it all on my own. And I don't know if she got in the bind. She was a single parent. All she had to do is come and ask me for money, and it just shocked us. And the sad part of all of that was when we discovered it, she had been diagnosed with breast cancer. And I met with her parents because I knew her parents really well. And, she died 2 weeks after, 2 weeks after I, said, why did you do this? Why are you doing this?
Crazy.
It was crazy, and it was really a hard spot, but she had embezzled over $100,000 from me.
Oh my God.
Before I discovered it. Well, I moved a lot of money, and she, thank goodness she didn't do it to any of my charities that I'm involved in or any of my board stuff. It was just out of the Infinity account. So I'm now super cautious. Nobody can sign a check but me.
We have 2 people who can sign checks other than Ray. But most everything is a 3-part authentication process, which is only terrible when he misses the window for authentication. We have to start all over from scratch.
Yeah.
That doesn't happen very often anymore. And I think we added Reagan to the authentication process to avoid that. Like if we're down to the wire, we're like, okay, Reagan, you got to go in there and approve this. But it gets checked by each person. So I might enter something in the first time, it gets checked by accounting, and then they do their authentication process, and then he's the last person to come in there and authorize the payment.
Well, I've been trying to get that set up for the last year so we can go on our RV, and I sort of have my mobile office in the RV. Does Ray do that? Is his RV set up to?
It is, and that's why we have this process, is so he doesn't have to be there for the bills to get paid. Which is why I try to get all of my speakers to let me pay them with my credit card, like Jay and Evan and all of them. Then I can avoid all of that nonsense with everybody else.
Jay? You're paying Jay?
Not today, I'm not, but I do pay him from time to time. But I'm like, send me
Every now and then.
QuickBooks or something like that.
Are you doubling down on Christy and I? Do you charge me when I go to the conference and Christy picks up some of the bill also? Are you doubling us here?
You know what? I'm happy to send you every single invoice I sent to you and Christy Full transparency, I've got no problem with that. Happy to do it. Comes out of my PayPal. You get those invoices, so does she.
I'm just messing with
Happy
you.
to share with you.
He knows because but even when people tell me that I'm co-sponsoring them with Brad, I always email him and go, just confirming co-sponsorship.
Oh, wait. There have been two situations where I've been co-sponsored by you. North Dakota, where I spoke all day, and then I was supposed to do Illinois, where you guys were going to co-sponsor me, but it got canceled. And now I'm doing it for free for Christy.
Yeah, Christy and I have done a lot of co-sponsor, and I'm all for that with Ray, because then I don't feel like I'm in any kind of a competitive world that way. Where some people that want to co-sponsor, are partners or something, that I feel sort of funny about doing that.
Hey, listen, I'm happy to send an invoice to both of you every time I speak. I'd be fine with that.
I bet you would.
No.
I know.
Hey, Christy, there's also one other thing that we plugged into the PowerPoint after I sent it to you. Jay and I are getting ready to start a national podcast called Tech Talk. And so I decided we're going to throw a slide in talking about that's coming soon. And that may be times when Jay and I are doing it together. There may be times when we're doing Tech Talk individually, but we're sort of trying to, I'll put a tagline on it, Jay, two healthcare experts that will have you laughing while you learn.
I like it.
I love it.
Yeah, so we're going to do some podcast stuff. FCA's asked us to do it at national whenever that happens. And so we'll do some podcasts, and we'll be grabbing people at the conference, maybe you, Christy, and talking to you about technology and what's going on in your world. We're going to make you laugh and have a great time at the same time.
Definitely. By the way, it is not for children. It's not PG rated. It's probably not even R rated. So get ready for some F-bombs, people.
I was like, oh, you're going to get to say the F-bomb without getting your hands slapped?
I got in trouble, Brad. I got in trouble in Missouri. Did Christy tell you?
No.
I dropped the F-bombs a couple of times. You know how I get sometimes. And I guess some person complained.
I have taught myself not to do that. I get wrapped up emotionally too, and I forget the time clock, and I forget. I did that the other day in your health tribe thing, and I'm sorry. I meant to start my clock on my watch, so I wouldn't do that. But man, I get wound up, and I can talk for hours about it. And
I know. That's why I had Christy. We were doing the mastermind event, and I had to hold up my phone and was like, "You're done. Your time's up."
Yeah.
It's okay. I've had to throw stuff at Jay. He was going to keep right for the man he's like, I only want to speak 2 hours. So we were splitting this 4-hour time slot. 3 hours into it, he was like, oh, wait, we're going to let Christy talk too on tech. And then I had technological issues. So I just started making shit up from the front of the room.
Oh my God. Yeah, that sucked. I mean, you were great, but that computer was from 1980. It's like the world, Brad, it was so old, it was using a VGA connection. That's how old it was.
Yeah. Can we talk about how I turned it into a learning opportunity? Why doctors of chiropractic do not put tech in their office is because they're afraid it won't work. And when it doesn't work, you just go with the flow because nobody else knows but you.
Exactly. Hey, I'll be right back. I need to blow my nose.
Well, good. I'm glad you left screen for that.
Oh, bless it, bless it, bless it. I need a black wall behind my home office like y'all do. That looks great.
No, I bet that's not his home. I bet he's at the office, because when he's at home, he's outside. My wife and I share an office, and we started to decorate. Typically, we have these big, huge images of our dogs, and because they're like our kids, and we didn't put anything back up. And so every time I'm on a Zoom or something, I think about, crap, I got to put something in the background. So I moved my Go Pokes sign the basket. So listen, let me tell you a quick story just before we get going here. A really sad thing. Most of you've all heard of the American Cancer Society.
Oh my gosh, wait a minute.
So my wife she is the chairperson for the Coaches versus Cancer program at Oklahoma State University, which raises hundreds of thousands of dollars for pediatric research in cancer. And they do that through the American Cancer Society. Her biggest sponsor is a restaurant here called Eskimo Joe's.
Hey guys, we're on air.
He donates tens, if not $100,000 worth. He's a T-shirt printer, has a big restaurant that's just sort of the college hangout place to be. And one guy that used to go to Oklahoma State University now is a cancer researcher in Los Angeles, wrote a letter. Coaches versus Cancer is actually a product of the Jimmy V. Foundation. It came about of about 4 top college coaches. One of them was Eddie Sutton, and that's who Kendra did this with. And this guy wrote to the National Association of Men's College Basketball Coaches and said, I just don't see how you can do business with somebody that has a Native American in their logo, an Eskimo, which he has had for 45 years.
Hey, Brad.
Yeah.
We are
I
live.
have a text for you.
Okay. Sorry.
I don't know what happened.
There's
Hi,
no-
everybody.
Chris said to check your invoices, Jay. Welcome, friends and family, to ChiroHealthUSA's weekly webinar series where we accidentally hit the go live button when we were doing our pregame talk about all kinds of stuff. Jay had to blow his nose. Y'all saw him eat his lunch, and we were all talking about invoices and all kinds of fun stuff about how we support you guys in the chiropractic profession. Now you know all the secrets. So, but to get started, I just want to introduce our speakers today. First, I have Dr.Jay Greenstein, who is a frequent friend and visitor to our weekly webinar series, and he is wearing an amazing shirt. You are so right about that, Sherry Ryan. It is fabulous. If you need one of those shirts, girl, you just send me your size. I will get it to you, to my friends in Alaska. Also, today, I am so excited. We have my good friend, Brad Koss. Now, many of you might recognize him. He is the president and CEO of Infinity LLC. And because of him, a lot of us are getting paid. The other really cool thing that a lot of people don't realize that what Brad does is he is like a data miner. Y'all just have no idea how much data he pulls in and the things that he can tell state association executive directors, people who are working with insurance companies in your state about where they're going wrong and how we're going to make it right. That's it in a nutshell, because it's so much more than that. So now I'm going to shush and quit gushing about my 2 favorite people in the world and turn it over to them. Okay, guys.
Hey guys, hello. How are you doing? It is so good to be here today, especially with my buddy Jay Greenstein. Jay and I do a lot of things together. We do a lot of talks together. If you've been to the Florida Chiropractic Association National Conference or any of their 5 conferences, you'll see Jay and I there having a great time and also talking a little bit about technology. And that's what we're going to do today. And some of the things that we've done with technology and how it's affecting you in your world and how it can affect you in your world. And I'm a talker with my hands, so I'll try to get them up here where you can see sometimes. But hey, Jay, buddy, it is good to see you today. And I think we're going to start out with your piece of it. What we do at Infinity is we are a national claims clearinghouse, if you've not heard about us. We take in claims and process those for you as a clearinghouse. We are known as the clearinghouse in the chiropractic world. And we started with that and doing analytics at Infinity. And then I saw the need for, hey, we've got to have something bigger and better, just focused on analytics. So I started another company, QVH Systems Consulting and Analytics Company. And that's all they do, guys, is analytics. We feed de-identified information into QVH. We're doing that with all specialties across the United States. We do that with individual practices, group practices. We also do that with hospitals and FQHCs across the United States. So we're doing amazing things. We represent at Infinity 21 state associations across the United States that we're giving them information back. We also have relationships with independent physician associations around the United States. Jay just happens to be involved in that. And we're actually going to start out with some of the information that we did as several very huge data dives for that in analytics. We also have 4 data scientists on staff where they're looking into that data, drilling down and trying to understand things that are happening in episodes, things that are happening on financial and reimbursement kind of things. And Jay and I have done a lot with multiple payers across the United States, but Jay is also going to talk today a little bit about something that we did with one of the major payers. And I'm going to share my screen here so I can get to that slide. Or Jay, it's on there now, so I don't have to
it's on there.
Yeah. So with that, I'm going to let Jay introduce himself, and then we'll get right into the slides, Jay.
So this is going to be fun because I can actually, I think, reverse the slides too. We both have control. This is fun. The reason I'm going back to Brad's slide is because I think it's really important for those of you that don't know Brad or don't know Infinity or QVH systems. I say this all the time, and it's because it's true. Brad is probably the most important non-chiropractor in the chiropractic profession. And he won't tell you this, but literally he has donated hundreds of thousands, if not maybe close to 7 figures of his own dollars at his own expense in order to make sure that we have access to the data that we need to understand the challenges that we face as a profession. And I'm going to give you very specific examples that we pulled with the data scientists from QVH Systems and Infinity, but I just think it's important that Brad get the recognition that he is due because he does it very unselfishly and doesn't talk about it. But again, he's investing so much money to make sure that chiropractic, our profession, is not only sustainable, but that we're prosperous. And so there's a lot of work that goes into it. And I got to give Brad a shout out because he doesn't give one to himself. So most of you guys know that I am a chiropractor. I have 4 divisions of my companies. I've got my chiropractic rehab offices. I've got a clinical research institute. I've got a sports performance and wellness company. And then I've got Kaizenovate, which is our new technology startup where we build mobile applications for chiropractic practices. One of the things that we're going to talk about today is related to a specific payer, and it's Aetna. So when you do a lot of advocacy work, you make a lot of friends. And so I'm fortunate. I've got lots of friends across the entire country. And last year, there was a bunch of friends that were kind of communicating and reaching out. And we all had this issue with Aetna around bundling of claims. And there was no clear methodology as to how these claims were getting bundled. But I will tell you that for an individual office manager to try and sift through and figure out when a 989 code gets bundled with a 992 code, how often it happens, sometimes it does, sometimes it doesn't. When do you appeal? When do you do a follow-up appeal? When do you just submit the notes? I mean, it's mind-boggling. But some friends of mine reached out to me, and then I kind of went to my network and asked a lot of people if they were having these same issues. Something came up on a couple of listservs, and we realized that Aetna was doing something. And what they were doing was that they were bundling claims, and they were bundling a variety of different codes together. And it wasn't always the same codes, which made it that much more confusing. So I called up Brad, and as I do when I see any reimbursement issue, with any payer, by the way, and I say, hey, Brad, I think we've got this issue. Can we talk to Alex, set up a meeting, and start kind of dicing through exactly what's going on with this issue? So of course, Brad's like, yeah, for sure. So we got we got Brad and we got Alex, who's one of his data scientists, on a call. We started to present EOBs to them. We started to describe the problems. And then Brad's team, Alex, his data scientist, started displaying the analytics. And I don't know if you guys can see this. It seems like it might be a little small, but at any rate, what we're showing here is the percentage of times that 97140 was bundled with another 97,000 code. And so what you can see here at the tallest graph, and again, I apologize because I can't really see the numbers. Christy, do you know if we can increase the size of the graph? Is that possible? Maybe not. Hold on, we're going back one sec. Nonetheless, you see that I think it was about 16% of the time 97140 was being bundled with another 97,000 code, and then less frequently with the other codes. Now, this is a little bit more clear, and this probably affects most of you, or has affected most of you. When you build out a 992 code, so typically it would be a re-exam code, this is the percentage of time that a 98940 was bundled with that re-exam code. In other words, they paid the re-exam code, but they did not pay the 98940 code. They did not pay the adjustment code. So for 99213, they bundled the adjustment code almost 28% of the time. With a level 2, a 99212, they bundled it almost over 20% of the time. Now, what's interesting is we subsequently met with Aetna after we had acquired all this data from Infinity and Brad and the data scientist. And what they had done is they originally just started to put edits into the system. They're using this new technology platform, and they put edits into the system because they were profiling specific doctors. They couldn't give us the criteria of the profile, but they said they were profiling specific doctors. And initially what they were doing is they were bundling the adjustment into the re-exam code. And then a few months later, what happens is they flipped it and they started actually paying for the adjustments and not paying for the re-exam codes. So if you're watching this webinar and you're like, wait, it was my adjustment code that got paid, but my re-exam code that didn't get paid, it is because initially they were not paying the adjustment, then they flipped it, and now they're not paying the re-exam. And the rationale that the Aetna, and by the way, this is the National Medical Director of Aetna that we met with at ACA headquarters. It was myself and several of the other states, representatives from the East Coast Association Independent Physician Network, the American Chiropractic Association representatives, and 4 representatives from Aetna that flew down from Connecticut to meet with us in Arlington, Virginia. They talked about, again, the reasoning behind these edits. They talked about the profile. They also talked about the flip of the adjustment code, first not being paid, then the re-exam not being paid. And that was because they didn't want to pay the re-exam because there are providers that are billing out re-exams every visit. There are people that do that. I've seen it for myself. I can't believe it, but there are providers that do it. They kind of screw it up for the rest of us. And so now anytime a re-exam was getting billed, even if it's 30 days later or there's a new diagnosis when it's clinically appropriate, they were still bundling the claims. So I'll get into a little bit more detail around the Aetna meeting a little bit later, but I want to show you the rest of the data that Brad and his team found. So this is what it looks like when you bill. Now remember, when you bill a level 1 adjustment, 1 to 2 regions, and you bill it with a level 1-3 re-exam code, they're bundling that 28% of the time. Then when you bill a 98941, so 3 to 4 areas, so now they're starting to bundle it over 32% of the time. Notice that it's going up, right? The percentage of bundling, the percentage that Aetna's not paying us is going up. Then you go to a 98942, so 5 region adjustment, they bundle it 41% of the time. So it doesn't take a rocket scientist to realize that the more expensive the code is that Aetna has to pay, the more likely they are to bundle the code. And you can see it goes up on every single adjustment code. Now, there were other manipulation codes that were billed. Even an extremity manipulation was bundled 31% of the time. So when we met with that, now we present them with the data, we present them with our own actual stories around what's happening in our clinics. We present to them that there's no way that any individual doctor could deal with the variety and the variation of all of these edits. All they said was, if you appeal it and all you've got to do is send in the documentation, then and the documentation supports the code, we're going to pay it. And if we don't pay it and you want to do a second level appeal, you can do that as well. And by the way, if you appeal it, if the doctor appeals it and Aetna overturns it at least 70% of the time, they're going to turn off the switch that's profiling your practice. Well, guess what, you guys? I was getting my codes bundled over and over and over again. This is just a small slice of the pie of the amount of bundling that Aetna was doing. They were bundling, and by the way, Brad had all of this data. They were bundling 97110 therapeutic exercise codes with other 97,000 codes as well. So Genesis, who is my electronic health records company, and they also do my billing for me, in combination with Brad and Infinity, we put together this massive spreadsheet. There were thousands of line item claims, like specific claims, de-identified claims. And we showed, based on all the claims that were submitted, all the support that we provided through documentation, and all the appeals, that we had an 86% overturn rate. So in other words, my claims are paid 86% of the time, and it would have been higher, except some of this wasn't done in time for timely filing. So we missed some of those claims, but we submitted that information to Aetna, and Aetna said, oh yeah, So apparently we missed that. You're right. Our people on our side said they need to turn off the profiling. So we're going to do that for you. Now you have to understand that's okay for my practice, but we didn't meet with Aetna for my practice. We met with Aetna, the ACA, the different state representatives from across the country, the ECA, IPN, Brad. We met with them because we want them to turn off these edits, period. So there's a lesson to be learned here. As we talk about claims data, and again, we have this data. You can, if you're an Infinity customer, you can go to Brad and he can share this data with you. And if you're not an Infinity customer, you really should be. But nonetheless, if you appeal the claims, if you send in the documentation and then you appeal if they don't pay, the likelihood is they're going to pay the claim. And then they will turn off the edits. And Brad, I'm going to let you talk a little bit more about just the massive amounts of appeals that have to happen. Because you've had some experience with this as well, where insurance companies have had massive appeals, and that's really changed their behavior pattern. So maybe you can talk about that.
Sure. Thanks, Jay. I think it's also important to note that in the data dive that we did for this, we're not using a statistical fluff on this. We actually look in the first dive alone, we looked at over 200 million claims. So this has great statistical relevance to it. And it's not a statistical fluff that a lot of people are used to when the government does things. These are hard one-on-one kind of numbers. So there is a lot of viability of this across the United States. I was actually involved personally as a data expert back in the days when the state medical associations filed a class action lawsuit under RICO against several major payers. Aetna happens to be one of those. And what happened in those cases, we found is they were doing this same kind of bundling technique, in a large way, the same type of things, where they were then paying the lowest code on the situation. And one of the things that we did was found that we could appeal those, that got their attention. And one of the things was told to us was Aetna has to respond to those appeals. And the simple fact is the appeal was actually less than the cost of responding to it. So we believe that appealing claims is a great way to get the payers' response to this, their attention to it, and make them change their attitude just because the appeals are a huge annoyance to them. And I think it's a great way to do that. So we've actually going to resurrect a tool that we had. We've been working on it to update it, but it will be an automatic appeal function for you. So it will give you opportunity with a single mouse click to automatically file that appeal. We found in a survey that it takes about an hour and a half to 2 hours to research and put the information together. That's why docs don't do a very good job of appealing. And so now we're going to have a tool here very soon that with one mouse click, if you're an Infinity client, you can create that appeal. You can print that off on your letterhead and send it in, or we're actually going to have a service where you want us to print it and send it in with some generic without your letterhead in it, but we'll mail it. So it really is truly simple mouse click kind of motivation to do that. And I think, Jay, that's going to, as you and I've talked many times, that's really going to help bring this to the forefront with these payers because they don't want to keep dealing with the appeals.
Yeah, and the fact of the matter is, we're all so busy during our days, and the office managers having to research why these claims are getting bundled. Where was it? What line item was not paid correctly? Was it the UCR that wasn't paid? Which one was it? Did it go to the copay? It's too hard to figure out. But thanks to your technology, the ability for us to be able to do this in the future is going to, first of all, not just help doctors be more profitable, but change the patterns of the payers over time because they're going to get inundated with appeals. So this is a major step for our profession that you're bringing to us.
Yeah, and the simple fact that then we have the hooks, Jay. So if you're an Infinity client, you actually get access to an entire panel of analytics just by simply being an Infinity client. You can see this. This is updated on a daily basis, so you can see how the analytics, not just this IPN payer kind of issues, but it'll help you understand and explore what's going on in your office. What kind of codes are making you your most money? What kind of lagger codes? What time of the year Are you doing your business? What cycles? Maybe it will help you understand when you could market it and try to level out those ups and downs of patients when they're coming in. Also things, one of the things that really stuck out to me was the delay in claims from the time you see the patient to the time you submit the claim. I mean, Jay, what sounds like a normal period of time from the time you see the patient to the time your staff has submitted that claim? What it would be a normal time frame for you?
Oh, it's real time. So when our charges are submitted, it gets sent right away. The doctor submits the charges, signs off on the note. We have a policy in our office. It gets done before 12 midnight every single night. We don't wait.
The crazy thing that looking at this data brought to us, we had doctors that were going over 300 days without submitting a claim. And I've got to believe the doctor didn't know that. I've got to believe that was a staff issue or some kind of issue that was happening depending on an outsourced service. So again, this is where Infinity Analytics and having access to that panel, the doctor can spend, I ask him to spend 1 minute, one time a week. And this Infinity Analytics is mobilized, so you can do it right from your phone. It'll help you understand what's going on in your office, and maybe you can detect some of those things that's got to be hurting your cash flow.
Hey, Brad, before you actually get into the COVID data, I just want to say something really quick. You know, for those of you that are Infinity customers, I do think it's important that you understand that it's not just a clearinghouse. I mean, they do a great job. Like we literally have never had any issues with the technology behind the clearinghouse, but you're contributing to the base of knowledge and the large data set that allows us to slice and dice analytics over time. Brad has data not just on our industry, but in the entire medical field. So his ability to look at what happens when patients make decisions, when they go to a chiropractor or they go to a medical doctor, what happens when they switch providers in the middle of care, what does that look like for downstream costs? Like he has all of that information that ultimately will help us with policymakers, legislators, insurance companies, so we can literally beat the drum of why chiropractic is such an important component of healthcare in this country and around the world today.
Yeah, Jay, a great example of that is some of the other tools that we're actually building for FQHC hospitals or hospitals around the states that we have a client is we're able to look at those patients and do patient modeling in those aspects. And patient modeling is where we're looking at their history. We're looking at times of the year that they come in, what they're coming in for, what their diagnoses are. We're developing some very cool predictive patterns on that. And one of the things that we determined is, hey, what if we could show in a predictive way what would happen if we interject chiropractic services, conservative kind of healthcare in the beginning of some of these crazy healthcare life cycles, I call it. Could we change those outcomes? And the great thing is we're finding that we can. So this is not only a great tool for researcher purposes because it's tying it to the data, not just statistical fluff like I talked about, but it's actually tying it to an individual patient, their individual life cycle, and how conservative care can be interject. Listen, in some of those cases, we saw $600,000 and $700,000 a year of healthcare expense, especially in some of the older populations, that you might could have saved half of that at least. That not only is making the patient better, but in some of those situations, it got very sad, especially when there were in-facility kind of care where the patient lost their life, Jay. And, you know, there would be nothing better to not only save money, but to save a patient life in those kind of scenarios. And so, you know, guys, we're doing amazing things with analytics, but we got to have you be a part. We got to grow it across the United States in a much bigger way. We try to offer a very cost-effective way to do that. We try to partner with like ChiroHealthUSA, with like state associations, and we're giving them data back at no cost. I don't charge any of my partners, and I try to pick good partners that are going to use that in a pro advocacy way, a humanitarian way, that they're doing the right things with it, not as a marketing ploy. So guys, you're not going to get any additional marketing over this. You're going to get guys like Jay and Christy, your state, local, and state medical association, chiropractic association, where they can bring about a change, as Jay said, through legislative efforts, to educational efforts, and the things that Jay and I are doing. We teach not only some of this kind of stuff, we teach about the ethics of things. And so, listen, we look forward to that. We want to help you out. We're going to do it in a cost-effective way. There's not very many practice management systems that exist in the United States that we cannot interface with. In the chiropractic world, we've got some of the big guys that we're integrated with, so it's a very easy relationship, and that's growing all the time. So, Jay, thanks to you and to Christy and those kind of things. I know we're going to talk a little bit about some of that technology that we did for COVID. If you want to grab and talk for just a second, I'll make that shift to that screen.
Sure. I think, as we have this conversation and we think about what the future of chiropractic looks like, I think everybody really needs to understand that organizations, professions, companies that can grow exponentially are literally the ones that are information enabled. And I think with Brad and all the analytics that we're able to evaluate and have at our disposal, we now become a much stronger profession, and we can do a much better job in helping our patients because of this data. And this is remarkable. I remember when Brad showed this to me when COVID first broke out. So this is super exciting, Brad. Why don't you share exactly what you built?
Yeah, so what we did was take a little bit of that data that Jay has been talking about that we collect. And, there was a lot of talk about how COVID is impacting practices. And everybody was seeing the same model about the COVID counts and the number of patients infected with COVID. And my mindset sort of twisted that. How is that affecting my clients across the United States? And so we haven't looked at it on a week-by-week basis of how it was changing. And so let me sort of explain. And everyone has access to that. If you look up here, you'll see the URL. If you want to take a second while I'm talking and copying that down, this is live. Anybody can link to it. Many of the state medical and chiropractic associations have linked to it. It updates Monday morning of every week, but it's a very cool look at what's happening. And it's
Brad, really quick, just read out the link because it's hard to see. They might not be able to see.
Sure. It is not www. It is straight up analyticsmobile.infinity. That's INFINEDI.net/patient visit counts. Counts is plural, and another slash. That'll get you to it. You can go on our Facebook account or our webpage and find a link to it if you can't make that one work. Just get hold of us, send me an email or Facebook message, and I'll be sure that you get it if you can't do it. But what we've done here is we look back to January 1st area of when patients were coming into the office. And because we're taking in day-to-day claim processing, and basically we're looking at unique patient counts on that, we were able to model that as that changed across the United States. So you're currently looking at this week, the week of July 26th through August 1st. And let me sort of explain the dynamics to you. The blue bubbles are a net national loss, and that's based on a county. You can zoom in on this if you want to, but we're going to look at the overall United States. But by county, and that's where there was a national loss in that county of patient counts. In other words, patients weren't coming in their normal stream that they were. So I'm going to animate this, and we're going to go back to the first week. This was the week of January 26th. You see there were a lot of green dots. Now watch as it progresses through the weeks. You will see where the green are slowly overtaking. And about this period of time, it really starts drastically changing to where on this week, you can see where that you almost had an entire change of the patient population that are coming into the offices across the United States. Look at all the blue. There was 1 week, I believe, that we were down. Let me go back and see if I can capture that. We were down over 50% of patients coming into the office. And as we rolled through that,
You can also see the telemedicine was up, though.
yeah, telemedicine was up at one point in time over 1,000%. And now what's happening, it came back, it bounced back a little bit in April. So we had a cycle where we had normal patient visits and they dropped drastically down. They came back in May. Here in the first week of June, they're coming back. And as we progress now, we're starting a little bit of decline, and we're seeing national losses of, 20% down. And now look, July 26th to August 1st, we've now gone down to where across the United States, we're down 43% of our normal patient counts for offices around. When you go and look at this live, you can actually mouse over and it'll show you counties. It also lets you select a unique state. We can pick like a Florida here, and you can mouse over and look at the counties. All the counties in Florida but one in Miami-Dade are down over 43% on average across the United States. And guys, this isn't a message to be scared of. This is what I'm trying to say. This is a message of saying, guys, we're in this together. This is happening not only in chiropractic, this is happening in all specialties. And so I think it's real important that we know we're in this together. Everybody's going through this, and we'll get past this. And so that's what I want people to understand and know.
Hey, Brad, will
Sure.
you bring up your desktop again? I want to see that one more time. I just want to point something out really quick.
Sure.
Thanks. So I think when you look at the state of Florida, what stands out to me is you've got this reduction in the total number of visits, and you've also still got a reduction in telemedicine visits as well. And I think the point of this is not just to be staring at data and being like, oh, it's up or oh, it's down. It's being able to think about what's happening next, to look at trends and say, okay, if X happens, I'm going to do Y. If Y happens, I'm going to do Z. So for providers that are seeing their in-office visits go down with this recent spike in the country, how are they preparing themselves to do telehealth visits? How are they staying connected to their patients so that one, patients can maintain or get a better outcome, or so they could just stay connected and communicate with them to make sure that when things settle down, that they're going to actually come back to the practice. There are a lot of practices out there that are doing that. I mean, we're doing that. We're always staying connected to our patients. Luckily, we have not seen the same reductions, knock wood, as Florida has in this particular slide. But at the end of the day, if we're looking at these trends, we've got to think proactively about what we do next.
Yeah, Jay, that's true. And again, it's not meant to scare anybody. It's to be a technological tool. And that's one of the things you and I have always talked about. How can you use technology? And guys, I got to be honest, I don't know how you would have a modern practice today, whether it's chiropractic, the MD world, any kind of specialty, without being tied to technology. We were in a chat session the other day to get vendors to connect a little bit. And I told them I was very proud because I started on this pathway 15 years ago. It was actually at FCA to get them to go from paper claims, which 80% of the doctors were still filing paper claims, to just getting them to change to electronic claim processing. And you know what? 5 or 6 years later, it declined, and we had more and more people doing electronic. To today, there are very few people that are filing electronic claims. And to me, that means doctors' offices, it has become a norm. And Jay, I think just like the other things that we're talking about, that becomes the normal practice today. you have developed an amazing application for any doctor to use. And that's a simple technology. You've made it very simple to integrate into an office. Guys, we have vendors all the time that Jay and I run into that have developed these amazing technology platforms. My ultimate goal as a vendor and sort of a leader in this technology is to be the ultimate collaborator that puts all of these technologies together to organize it in a way that you, the practitioner, can see collectively how you are changing the world. And in my opinion, Jay, that's what it's all about, is not only being a great healthcare practitioner, is you got to go out and change the world.
Yeah, I mean, that's why we do what we do, right?
Why we do what we do and why we're passionate about doing that. And so, Jay, I can't wait to move into the future. You and I have also got another cool endeavor that we're going to do. I didn't send that slide to Christy. I don't know what happened. But guys, Jay and I are launching a new endeavor called Tech Talk. And Tech Talk is a podcast. And we are going to open the doors to having fun. It'll be two healthcare tech experts making you laugh out loud, roll on the floor while you learn, guys. We're going to have an unbarred podcast. Hopefully we get where we maybe can do them every week and take on subjects. We're going to bring in other providers, other experts into this, have a great time doing it, and help educate you of how you can use these platforms.
Yeah, it's going to be super exciting. And I'm very much looking forward just to continuing to work with you, Brad. We've been doing this now in Florida, doing the tech track for a couple of years. And I think the response that we've gotten has been pretty remarkable. I mean, doctors, they want to learn more about technology because they understand how it can actually help them in clinical practice every single day. It can help them be better clinicians. It can help them run their office more administratively efficient. And ultimately, it can help them make more money and help more people, which is why we do what we do, right? We want to be paid for the value that we deliver, and we want to help as many people as we can. I think also for me, making sure that folks on this particular webinar understand not just the fact that we have this data available to us through Infinity and QVH systems, and that we're using this data to deal with payer abuse, but you guys can play a role as well. And again, I just want to emphasize, or we want to emphasize the point that when you have reimbursement issues, make sure that you bring them up to your state leaders. Make sure that you reach out. If you're a customer of Infinity, reach out to Brad, because there might be other people who have the same issue where we can look at the data and then go to literally to the top of the food chain at these carriers and deal with these issues. We know from experience that dealing with low-level insurance company reps, they don't do anything. They get nothing done for us. But if we get to the highest level people, like the chief medical officer, those people will definitely have our ear. And I think, with that note, we'll see what happens. But I think we're going to be able to move the needle as long as providers, like Brad and I have been saying, do the appeals. So when it comes to the big data, that's kind of like the take-home point. Identify faulty claim reimbursement. And if you're seeing it as a pattern, make sure you notify your state associations and specifically your clearinghouses, and hopefully it's Brad. The second take-home point, really quick, Brad, I just want to say around the COVID data, and I don't want this to be dropped or kind of missed in the conversation, but we want doctors to be prepared for anything that happens. So if I'm you out there, and Brad just sent the link, and I know Christy put it in the chat, like every day I'm checking that and I'm comparing the national and state and county averages against my own practice, because it might portend what the future holds for me. And then what steps are you taking? There's a ton of resources on the ChiroHealthUSA site around how to manage through COVID. We're not out of this pandemic yet. Use those resources to strengthen your practice. Now is the time to work on the business and not just in the business.
Yeah, Jay, I talk about changing the world, and I remember something that you said. You remember those days when we were setting IPAs up across the United States, and we were talking to docs about changing the world, and you said something I think is a great thing to close with, is the fact is, Jay and I can go up the hill and try to change and fight the battle and win the battle, but Jay and I can't do it, guys. it takes an entire army to climb that mountain and to fight that battle. And that's what Jay, we aren't getting paid to do this. I spent $500,000 last year doing this. And I'll spend another $500,000 this year if I have to, and for the rest of my life. But Jay, the thing is, I want to change the world. You want to change the world. Christy wants to change the world, but it takes an entire army to do it. So join us in this fight to do this in some aspect, guys. Christy, I think we're ready to turn it back to you.
Y'all did such a good job. It's so hard to be the person that comes on after you two.
I just want to say hello to Sherry and Chris. I see some of those chat comments. I just want to. Hi, ladies. Miss y'all.
Oh, that's too funny. And again, if you want one of those fabulous T-shirts like Jay has on, I have plenty of them since we're not traveling very much this year. So email me, Christy at ChiroHealthUSA.com with your T-shirt size and the address where you want it sent to, and we will get it to you.
They're very soft. Very soft.
I'm sorry, Christy. Next time I'll wear mine. I was thinking Oklahoma State today, but I will wear my CHUSA shirt next go around.
Well, I don't blame you. I'm a little sad that, that there's possibly no football season. I'm like, what am I supposed to do with my weekends if I'm not traveling and can't watch football?
So far, we're still good for go, but that could change with all these other conferences jumping out, man. But we got to be safe. That's the number one thing here.
Yep. It is. And I just want to add too, because, first, because we're, focusing on COVID these last couple of weeks, I wanted to remind y'all that we have Don Rasmussen, and we have somebody with the Small Business Administration, Kathy Cook, who's coming on to talk to us about the do's and don'ts of using your loan. We want to make sure that everybody who got those SBA loans gets the maximum forgiveness. So make sure you join us for that webinar. And you'll notice Jay talked about making sure you're utilizing the resources available. Everybody has resources available. You can go to the ChiroHealthUSA website, click on COVID. Even our logo is wearing a mask. So,
yeah. And Christy, everybody out there, Jay and I are always available to do this. We love doing this. And so if you're around one of the conferences that we're talking, be sure to sit in on one of our classes. If you're at FCA, really do. It's a day-long tech symposium that you're going to learn some great things about applications of technology. Then you're going to hear Jay and I lecture a little bit about, not really lecture, but converse about technology and ethics and all kinds of things. So join us if you're at one of the FCA conferences. Hopefully they will happen at the end of the year.
And they are so incredibly fabulous. As somebody who goes to all of those events and sits on those classes frequently, I never get tired of learning about technology. And I think that it's wonderful. Again, Jay tried to talk about the importance of what Brad does too. We've talked about in the last month. I don't know if y'all are noticing there's some consistency here. We're talking about fighting denials, reviewing your billing, make sure it's timely, stay on top of this stuff. Things will never get better if we don't start standing up for ourselves. And when you see something funky, tell your state association, because the first person they're going to call, or the first people they're going to call, are Infinity to talk to Brad and Jay, because they'll be able to take that data and say, here's how we're going to fight this for you. If y'all only knew half of the battles they fought with the help of Jay and Brad, it would blow your mind. So again, make sure you're utilizing COVID resources. Make sure you're staying on top of your billing. We want you to get paid, and paid very well, for the services that you provide. You are essential more now than ever before for the health and wellness of this country. So again, check those out. And I'm going to close with this, because everybody feels something about COVID, and it's all over the rainbow of feelings. So I even made a joke about the mask wearing logo, but the bottom line is this. So I had a conversation with somebody yesterday because they were looking for someone to fill in at a sole proprietor chiropractic office. The chiropractor was diagnosed with COVID 2 weeks ago and lost his life. His wife is looking for somebody to keep it open long enough for them to sell it and treat their patients. They had not been doing a very good job of following OSHA guidelines and keeping things safe, and no doctor will step foot in that office. So make sure that you're doing everything you can to protect yourself, protect your patients, and to protect your team so that you can be there, because nobody benefits from a chiropractic office that is not open.
Well said, Christy.
Yeah. Good job. Christy, thank you for the opportunity to talk. My partner, Jay, thank you, buddy. I
Thank
appreciate
you, guys.
it. No, Ray, thank
Thanks,
you.
Christy.
Thanks.
Hi, y'all.
Bye.
And for those of y'all who got to hang on for the first part where we were talking about all kinds of nonsense, well, trust me, if you hang out with us at FCA, you'll hear even more, and it's going to be fabulous. Y'all have
A whole lot more.
amazing rest of your day.
Bye,
A
guys.
fabulous week, and we'll see y'all next time. Bye-bye, everybody.
Bye.